Hey guys, it's Dr. Paul Thomas.
And Dr. Raquel Orlick.
And we're at Plum Health, and today we're talking about cold, flu, or strep.
Yes, sometimes this can be a really challenging topic because I think that some of the symptoms do overlap, and it's important that we can at least try to shed a little bit of knowledge on how we can distinguish between the three different types of common respiratory illnesses.
Yeah, so we're going to dive right into this. This is a handy chart that's been floating around the internet, and I think it just explains things really nicely. The left-hand side of this column are the cold symptoms, the right side of the flu symptoms. So we're just going to run through these. When you have a cold, you typically have like a stuffy nose, a runny nose, sneezing, coughing, and a sore throat. Those are your quintessential symptoms because the viral tissue, when you have an upper respiratory infection, the viral particles tend to go to the back of your throat and irritate your throat, cause your mucous membranes to swell up, and that's why you get the runny nose, the sneezing, the coughing, the sore throat. Mm-hmm. For the flu, on the other hand, you have a dry cough, you have less mucus production, you have really severe body aches. Sometimes people say, I feel like I've been hit by a truck, or I feel like I've been hit by a train. And one thing that we look at when people come to the office is like what we call the pajama sign. If somebody's feeling so weak and so tired and their muscles are so achy that they can't change out of their pajamas into their everyday clothes, it's typically more severe because it indicates that this might be a flu virus. Mm-hmm. They typically have a higher fever, and it's usually like a sudden onset. So these folks are saying, I was fine yesterday, and then I woke up this morning, I just felt terrible, like I couldn't even get out of bed. Mm-hmm. Any other things you want to add to this one?
I think that the flu is especially the one that we worry about because these are usually the illnesses that could progress into something a little bit more serious, which is especially why it's so important to get vaccinated with the flu, for the flu shot.
Yeah. And is the flu all right, so it's February 10th right now. Is the flu shot still going to be effective for me?
Yes, it would be. Because flu season is not over. So yes, it would be better if you got the vaccine earlier in the season. It takes a minute for the body to build antibodies against the flu virus.
Yeah.
But it's going to at least give you some type of partial protection against instead of no protection at all.
Yeah, exactly. And by a minute, it probably takes a week for it to work when you
Not
get the
a minute.
vaccine.
Yeah.
And, we still have the vaccine here if you need it. It's $20, and it could potentially save a trip to the ICU or, a week away from work or potentially infecting your kids or an elderly adult in your community. And that's a real thing that people don't realize. You get vaccinated so that you don't infect the 80-year-old woman that goes to your church or your children because they are more vulnerable to getting really sick from the flu and potentially dying.
Right.
So that's why we get vaccinated, to protect others as well as to protect ourselves.
Right.
Here's another little comparison. Cold, loss of appetite, sore throat, sneezing, cough, sometimes vomiting. A lot of times you produce so much mucus and you can swallow that mucus. It can irritate your stomach lining and you end up vomiting that up. Mm-hmm. With the flu, you get more severe muscle aches like we talked about, the high fever, the headache, fatigue, chills. One more, I like this Venn diagram. It's cute. So with that cold, the symptoms tend to be more mild, causes some mild fatigue, gradual onset, whereas if you have the flu, influenza, severe symptoms, body aches, sudden onset.
Yeah. Have you ever gotten the flu, Dr.
I've never gotten the flu, but
You haven't.
I get the flu shot every year, so
Yeah.
Got to keep with that trend. The next thing we got to talk about is, there's a cold, and then that can affect your throat, cause that sore throat. But then there's strep throat. So What's the difference?
Yeah, so initially when you first talk to a patient, they say, my throat hurts so bad. It feels like it burns when they try to swallow something. So at that point, you don't really know just from that history alone whether they have strep throat versus a viral pharyngitis. Because even when you just get the common cold, it initially does present with a pretty painful sore throat, which then progresses into the common symptoms of the runny nose and the cough that we're used to. However, strep throat is different. It's an actual infection of the tonsils in the back of the throat. So it's a lot more localized, you can imagine that. So it's actually the strep bacteria that's infecting the tonsils. So if you look in the picture right here that we have up, if you can see the difference of the strep on the left versus the viral pharyngitis on the right, you can see that there's actual enlargement of the tonsils. You can see that they're infected with some white purulent exudates, which is what we call.
Or pus discharge.
Pus, yes.
Yeah.
And then on the right, you can just see it's just widespread irritation of the throat. See, it looks quite a bit different.
Yeah, and that's the difference between the bacteria and the virus.
Sure.
And then if I have a viral sore throat, if I have a virus, do I need an antibiotic?
No, you do not. Antibiotics only treat bacteria or kill bacteria. Bacteria, those are different than viruses. Viruses, the only thing we have are vaccines to prevent them from occurring. Unfortunately, we don't have a vaccine for the common cold.
Because it changes so rapidly that we can't develop a vaccine for.
Yeah.
And there's so many different strains.
Right.
Whereas the flu, we can have like predicted strains, and they put together 4 different strains and they include them in one vaccine.
Right.
It usually confers like 50% protection for the season.
Right. Now, and going back to strep throat, it's not only the sore throat symptoms that they have.
Yeah, let's talk about that.
So other symptoms that we would ask our patients, especially some of the other things would be, do they have swollen lymph nodes? So do they have some tender lymph nodes that they can feel on exam? Additionally, a lot of times they're more likely to present with a fever, and also they don't have a cough. So this is very important because with the traditional common colds, cough is one of the most common symptoms that you'll have after a few days of having the sore throat and the runny nose because of that extra drainage from the sinuses that irritate the throat.
And usually strep throat affects younger children, and why is that?
Well, a big part of that is because their tonsils are larger. They, as we age, our tonsils do tend to reduce in size, and then so that's a big part of why when we think of strep throat, we're more thinking about a child presenting with sore throat, that we would be more likely concerned for the infection. And of course, physical exam would help us determine that.
Yeah. And so like when somebody presents with a fever, sore throat, pus, discharge from the tonsils, and they're under 14, it's kind of like a slam dunk. This child has strep throat. At that point, we would typically give them an antibiotic. Right. Because we're treating a bacterial infection, and the typical antibiotic would be like amoxicillin, usually a liquid form or 500 milligrams twice a day, depending on the age and the weight of the child. And so this slide that we were just looking at, these are all the criteria, and if you meet these criteria, you get a point. And here the points matter. If you have 4 or 5 points, you should definitely get antibiotics. But if you only meet one of these criteria, you do not need antibiotics. It's most likely a viral infection. If you have 2 to 3 of these, it's kind of a toss-up. Sometimes we'll do a strep test, a rapid strep test in the office, and if it's positive, we'll treat. If it's negative, we'll just kind of watch and wait. If it gets worse, we can treat later. Right. But oftentimes it just gets better on its own. Right. The last thing that we wanted to bring to your attention is that the commonality of the flu. I know there's a lot of talk recently, especially in the media, about coronavirus and how that's affecting China and affecting the United States. But really, if you look at it, I think there's been 11 documented cases of the coronavirus in the United States, whereas there's been 22 million cases of the flu.
Just in this season alone.
Yeah, just in this season. So 2019, October 2019 to today, February 2020. So that results in 10 million office visits, 210,000 hospitalizations, and unfortunately 12 to 30,000 deaths. Right. So this is why it's so important to get the flu vaccine, because you're trying to reduce your risk of getting the flu virus. If you do have symptoms of the flu, it is treatable. You have to treat it within 24 to 48 hours to make any impact. And what we typically use is Tamiflu or oseltamivir, and that can reduce the duration and the intensity of the flu virus symptoms and hopefully prevent you from spreading it to other people. But like, what are the best practices for preventing any of these infections? What can people do to prevent these sort of things?
The number one thing that you can do is wash your hands regularly. So that would be number one, wash your hands regularly. Number two is if you're going to touch your face, you're going to eat, you're going to rub your nose, rub your eyes, you must wash your hands because, you know, as the day goes on, there could be virus particles anywhere that you touch, especially doorknobs, tabletops, you know, door handles, grocery store carts. So
everywhere.
It's everywhere. And then especially if you are sick, make sure that you're covering your cough. Make sure that if you're going somewhere where potentially you would be surrounded around people that are more vulnerable, so children or the elderly, and you have to be there, you could even wear a mask and make sure that you keep your distance. Of course, make sure you're not sharing any utensils with others, sharing drinks. That's always really important.
I would just say as well, get your flu shot if you haven't done that already. That's definitely a big one. And then if you are sick, don't go to work. A lot of people say like, I have to go to work, but you know, you don't want to run the risk of infecting everybody at the office. You got to think like there are people in your office who have families, either young kids or older adults that they take care of. So you don't want to put people at risk that way. Right. So if you need to visit a doctor and get a work note, you should definitely do that. Stay away from the office. You know, I was talking to somebody recently and they said that they canceled their office, closed for like 2 weeks just so that everybody could work from home to reduce the outbreak of a recent viral infection at their office. So, you know, that's kind of an extreme measure, but it just shows the importance of not transmitting the infection. And there are more important things than being at work.
Right, exactly. Especially if you can work from home.
Yeah, totally. So thanks so much for watching this video. As always, if you have any questions, don't hesitate to reach out. We're at plumhealthdpc.com, and have a wonderful day.